first we will have everything recorded, and we have the e-prescription. We have also the new feature of reminding the patients of their follow-up. And also, I'm not bothered to go to Western Union or OMT and collect my money. So everything is on the app. I have many patients in Africa and Iraq and also in the Gulf who left Lebanon after the crisis, after 2019 and after Beirut blast. So they wanted to continue with me. As Dr. Layan said, they have this trust and this, not also the trust, sometimes we have a specific relation with our patients. Why did I don't find this in doctors living in Africa or Canada or even in the Gulf region? So they want to continue with their doctors. هلا بيروحوا يمكن اوقات عند specialist ياخذوا prescription to get their medication from the pharmacy or to do the lab test. بس بحبوا على طول ياخذوا the second opinion يمكن من الدكتورز اللي كانوا عم بيتابعون. So I'm treating mainly patients for diabetes. I'm doing the follow-up on Drapps. I used to do the follow-up on WhatsApp, but I'm really bombarded with my WhatsApp. I have more than 1,500 messages right now.
Wow.
So I'm moving my patients to Drapp.
When Drapp started, usually it just coincides with the beginning of the COVID, and usually it helped a lot because we were not available in our clinics physically. We're not available, and let's be practical. It helped us not only to help the patient to give the medical expertise, to consult, to treat, but to have some income for us. So let's be practical. That's why I don't want to really make a lot of theoretical speeches. So that was a source of income, okay, to be able to get patients to really basically consult us. So in my experience as a pediatrician, kind of busy pediatrician, the success story, and at the end, it's a success story for increasing the income. Okay, it's an add-on for my income in my clinic. So now I have 2 consultations before going online, and this is a nice income.
In the beginning against any telemedicine applications in my life, but when I saw Drapp and I saw the application itself, I found that it is full of taking history of the patients, medication I need to give, or any even investigations. So I found that the application is very close to what we actually doing in the clinic. So I don't forget my patients because, sometimes we need the documentation, and the application provides us with documentation for each patient and registration, which is very helpful for me. When a patient calls me back in a month or 2 months, I can recall through the application what is exactly the problem, what medication was prescribed, the labs. Even in the chat part, I can share with the patient some reviews to read, some papers to read, which is very helpful compared to other applications that I have been introduced to before.
Telemedicine and Drapp particularly has the potential to make it a big revolution, the way healthcare is delivered. So it made it, making it more patient-centered and accessible for all. I'm not going to talk about COVID and the importance of it and the distance. I'm not examples how I used to Drapp, because one example is the use of Drapp for post-operative follow-up appointments. And after surgeries, patients often require several follow-ups appointments to monitor their recovery and progress. So with Drapp, patients can have virtual appointments with me to discuss any concerns, review imaging studies, and adjust their rehabilitation plan as necessary. So they don't have to come back again to my office to show me the x-rays, to show me how they feel, to tell me how they feel, and if there is any problem. So instead of WhatsApp calls, I'm just guiding them to Drapp. Another example is in pre-operative consultations or second consultations, because these patients often need to have a consultation with me to discuss their medical history, medications, and any potential risk associated with surgery. So using Drapp, patients have these consultations remotely, allowing for a more convenient and efficient process.
For maybe in anxiety also, the availability of this application, you can do a consultation anywhere at any time, and usually I do them out at the time. Maybe I'm taking my coffee in the morning and this time, so it's very easy and accessible for us and for them.
Technology needs healthcare at Drapp, so I am so proud to be a part of Drapp's medical team. Thank you all.
Thank you.
بتسهل للدكتور متابعة المريض، وكمان إذا طلب منه لاب انفستيجيشنز العيان بيعملها وبيتابعها برضه، فالحقيقة يعني إنجاز جميل جدا.